All right, class, today we're going to be doing a presentation on sealants. So I'm going to go over the course objectives first to see what we'll be going over in Unit 5. So our objectives for today are identifying the materials necessary to complete a dental sealant, list contraindications and sequence of materials used for creating a sealant, discuss proper sealant materials used, explain the sealant check that you do afterwards, and also discuss and memorize the proper condition for applying a sealant. Now raise your hand if you know what a sealant is. Neither. Oh, one of you. All right, that's good to hear. So what are sealants? They're a technique to prevent caries. So caries is another word for cavities. They're able to prevent by sealing off the pits and fissures of the tooth. They're applied to hard-to-reach areas for the patient, which is usually the deep pits and fissures. I have a visual after this that will help us understand that. And it's also best to apply it when the tooth is newly erupted. That's because that's when the tooth is less calcified, so it's less defensive against the bacteria in your mouth. So what you want to do is when it's newly erupted, you want to get to it before it has a chance to decay. It's very common for kids to not be very good at brushing their teeth, and that's why it's a good idea to usually use this practice in kids, but they're also available for adults as well. And then you can also, it's most common in pediatric dentistry due to teeth being more susceptible to caries, as I said before. But it can also be used for adults, and that's always good for adults who also have deep pits and fissures and may have had sealants in the past and have worn down, because they are more susceptible to wearing down. So some contraindications. A tooth with a carious lesion present. So do either of you have any idea of what that means?
Cavity?
Yes. So you don't want to apply it over a cavity. It can be a small incipient lesion, that's the one where it's only in the enamel, but you don't want it to be too deep because then you're just sealing off the bacteria and it's maybe going to make the problem worse and it's going to be harder for the dentist to detect. Also, a tooth whose structure is compromised, so you don't want to obviously apply a sealant to a tooth that is broken or has a chip in it. Some chips, if they're small enough, is fine, but you want to make sure that it's a good tooth, healthy structure. And then also, it's recommended that you use four-handed dentistry when applying in difficult cases. So that means a kid who's too squirmy, or maybe somebody who can't sit still for very long. And four-handed dentistry is just when you have one person applying the sealant itself and the other person retracting, as well as using the HVE, which is the high volume evacuator. So you want someone else in there just to make sure that the area is more clean. So for application, starting with this, you must clean the surface of debris and bacteria before applications. So you don't want to place fluoride before placing the sealant either, but you want to make sure that the bacteria is not present on the tooth anymore, or else you're going to seal that in, and the sealant material doesn't kill the bacteria, unfortunately. So if you seal it in, then the bacteria is just going to be able to grow under that material. And then your armamentarium, or your setup for preparing a sealant and applying one, is your personal protection equipment, your basic setup, which is your dental hygiene basic 3, also non-fluoridated pumice, and coronal polishing brush. So does anyone know why you don't want to use fluoridated paste?
No.
Because you don't want to apply fluoride beforehand, remember? Because that sometimes remineralizes.
Yeah, but why?
Sometimes that remineralizes the enamel, and you don't want the enamel to be mineralized. You want it to be easier for the etchant to work and create grooves in the enamel so you can have the sealant attach better. You also want to have an applicator to spread around the sealant or the etchant material, so a microbrush kind of helps drag it through the grooves and all the little places you want to get to. And then you also need the etchant, which is generally 37% phosphoric acid. So the etchant is something that helps etch the tooth. It sounds really simple. So what it does is it goes into the enamel, creates an uneven surface that etches into the otherwise smooth enamel surface. So when the sealant is applied, it gets locked in because it's not easy to stay attached to something that's smooth. And then you also want to have your sealant material and read the manufacturing directions on that. And then you also want to have the tips used for applying the sealant and etchant. So you want to make sure that you have a good flow of material beforehand too. And then you also want to make sure you test it right before you put it in the patient's mouth again, because you don't want to go in the patient's mouth and just have a giant splatter of etchant material or sealant material just randomly in the mouth. You want to make sure it's a good smooth flow. And then also you need a curing light. It's more common to use curing lights rather than chemically activated sealants. And also you need eyewear, cotton rolls, cotton roll holder, and dry angles to isolate the area, an air water syringe tip, a saliva ejector which helps get rid of any excess fluid, as well as a high volume evacuator, and then dental floss and articulation paper. So as I said before, sealants can be chemically activated. Those are usually two-step processes. And there's also light-cured sealants. So light-cured sealants are preferred usually just because they're a little bit easier to apply, and they don't start curing unless you're ready for them to cure when you apply the light, or if you have excess light on it, but usually you want to have it in a dark environment. This is a picture of the setup for some of the sealant stuff. So this is the curing light. This is the etchant gel with the tip on there that you want to make sure it's flowing smoothly out of. And this is the sealant material. Every manufacturer's directions for each different brand is going to be different. So you want to make sure you read the directions before you grab it out and put it in a person's mouth. And down here I have how the curing light works. So it works through a polymerization process. So that's when simpler molecules called monomers, just one little unit molecules, connect together when they're exposed to a certain stimuli. In this case, when we're using LED lights, that's the stimuli. The monomers and the sealant, when exposed to it, start to link together, and it creates a hardened material that we know as a sealant on the tooth surface. So I have some pictures here too. This is like a step-by-step, and I'll be going over that later as far as what goes into placing a sealant. And I also have a ADA quote. So sealants on permanent molars reduce the risk of cavities by 80%. And that's because when teeth are first erupted, they're the most vulnerable, and also children aren't the best at brushing their teeth, so it's really a good preventative tool. And then also I have a picture here where you can see that the toothbrush can't reach into the groove right there. So those are the areas we're aiming to seal off. So I have the application steps here. First, you want to use that non-fluoridated pumice and prophy brush to clean the tooth surface of bacteria. And then you want to rinse it for about 10 seconds. After that, you want to isolate the field with cotton rolls, a cotton roll holder, which is used only on the bottom jaw, and then also dry angles. This allows your field to remain dry and not contaminated with saliva, because saliva is full of bacteria. So you want to make sure that you keep the area dry. You also, after applying the isolating materials, you also want to dry it with the air water syringe tip for at least 10 seconds. The cotton helps keep the tooth dry, but you want to make sure you use the air to make it extra dry. And then after drying for at least 10 seconds, you want to apply the etchant to the pits and fissures and etch for 15 to 30 seconds depending on what the box says. After letting the etchant sit for a little bit, you want to rinse the tooth thoroughly after etching for 10 to 15 seconds if it's liquid, 30 seconds if it's gel. In our clinic, it's gel, so we rinse for 30 seconds. And we want to make sure that we leave the etchant on for the proper amount of time, because if we leave it on for too long, it's going to etch too much. And if we don't leave it on for long enough, it's going to etch too little. So it's really good to time yourself. And then you also, after rinsing off for 30 seconds, you want to dry the tooth thoroughly again for 15 seconds, and then if it's etched properly, it's going to look like a chalky white surface. And that just lets you know if the shininess is gone, then that just lets you know that it's properly etched. And then after looking for that chalky white appearance, kind of tracing it over with your Shepherd's Hook Explorer and your DH Basic 3, you want to apply the sealant and drag it in the pits and fissures, covering the etched areas. If you leave the etched areas uncovered, then that area is more likely to be susceptible to decay just because it doesn't have that protective mineral layer within the enamel. And then after applying the sealant, you want to cure the sealant for the proper amount of time depending on the manufacturer's directions. And then after that, after applying the sealant and also using the eye shield, you want to make sure you don't look directly at the light because it's a little bit too bright for our regular eyes. So you always have an orange protector. After doing that, you want to assess the sealant for bubbles, voids, and defects with an Explorer, and you always want to do this before taking the isolation material away, just because if you do find any voids or anywhere where you need to put extra, you don't have to re-isolate the tooth, re-etch it, make sure that it's clean. You want to make sure that you keep it clean, so if you have to put any more on, you're all set to go. So once you're done checking for any defects and you don't find any, you check the interproximal spaces for residual sealant material. So you take the floss and you go through the contacts. And it kind of grabs on any residual sealant material that might have been cured where it shouldn't have been. And with that, you can either pop it off with an Explorer or kind of take it down with a slow speed. After that, you want to make sure the patient bites down on articulating paper. Articulating paper is just a dyed piece of paper. If it's bit down and it has high areas on the sealant, it'll dye it blue. So you want to make sure you check it with articulating paper to check for high areas. If they find any high areas or if they feel like their bite is weird, you can adjust it with a slow speed. Lastly, you want to document. So what you do is you document the kind of etchant used, the sealant material used, as well as what teeth were done. And you want to make sure that you document it, that it was approved by a dentist. Because a dentist is the one who prescribes the treatment for sealants. So I have some pictures here. These are good visuals. So this one is of a lower tooth being isolated, about to have a sealant being placed on it. Keeps the area really dry. And then up here, since we can't really have like a lash that goes into the jaw, we use these cotton rolls just to keep the cheek away from it because, as we all know, cheeks have saliva ducts in them. So if a cheek is touching a tooth, it's probably going to get wet with saliva. So what you do is you just put a cotton roll in that space between your gums and your cheek, and you make sure that it catches any extra moisture. And then retracting there, that could be done in four-handed dentistry, and that's always really nice because then you get a better field of vision. So you can see here how I have a before and after picture. So before it's kind of like a chalky white appearance, and after it's more of a shiny appearance. So before here, this is kind of what it looks like when a etchant material is applied and rinsed off. It's chalky white, and that's when it's more susceptible. Afterwards, it's going to look like this. So when you're looking in the mouth for restorative materials, that's always good to look for the difference between sealants and composites. Composites are going to be more defined to the tooth structure. So that's going to be more sculpted by the dentist, as opposed to sealants. It kind of flows into the pits and fissures. It looks more like a pool rather than something that's molded to what the tooth anatomy usually looks like. So when you're looking in the mouth, if you see anything like this, where it's just kind of like a pool and not necessarily molded, it's probably a sealant. And it should look like this afterwards, so you can see that all the chalky white areas back here were turned into areas covered by a sealant glossed over. And that just helps make sure that the area there is going to be sealed off and protected from any bacteria. All right, so after going through that, we have about 2 minutes left before going to our worksheet for today. So do either of you have any questions?
So do you do this when people are adults too, or just when they're kids?
You can do it to adults. I actually had some done like 2 months ago, so you can do it to adults. Usually it's kids just because their teeth are more vulnerable and because they're not the best at brushing their teeth, but it can be really beneficial for adults too. It's
do you
just
have
not
to
as common.
redo them at any point?
Yeah, so sometimes Sealants don't last forever. So when people come in and you have partial sealants in there, or you have a tooth that used to have a sealant on there and it's not there anymore, you can reapply a sealant if a dentist deems it necessary. All you'd have to do is just re-etch and make sure that the area is sanitary. You don't have to remove the old sealant material on the other part of the tooth, if that makes any sense. Good question.
Is there ever a reason not to choose to have a sealant applied?
So if somebody has tooth anatomy that lends itself better to being cleaned, so maybe not as narrow of passages pointing down, if it's more of a flat surface, those are teeth that don't necessarily need to be sealed. Some people would probably choose not to get them sealed just because it's an extra cost. But sealants can be very beneficial for a lot of people. But for somebody who doesn't necessarily need it, it's not going to be bad for them. It's just they don't necessarily need it to protect them from getting cavities.
What does it cost for a child to have sealant applied?
So in our clinic at the school, it costs $10 per sealant. But in an office, it can cost probably 5 to 6 times that, if not more. So it does cost a lot of money, and insurance does pay for it. But it does need to be approved by a dentist to be paid for. And that's probably why some sealants aren't applied to.
So you're saying it would cost $60?
Yeah. For one.
Is it? Oh, for one tooth?
Yeah.
Oh.
I know. Yeah.
Yikes.
Good question. All right. Any other questions?
No.
All right. Thank you guys for listening.